Thank you. My name is Roland Simon. I'm with the Health Quality Council of Alberta, and this is our primary care patient experience survey where we talk to Albertans and get their feedback on their experiences when they visit their family doctors. Our main goal with this work is to really bring the patient's voice to the forefront and use that voice, the experiences that they had, to be able to contribute to improving healthcare in the province. Excuse me. With this work, we're reporting directly to primary care physicians. And it's really important to understand that we're not doing this to judge or rate individual physicians, but that's up to Rate MD to do, but to provide meaningful and actionable feedback that they can use to improve their care. We are well past 2 years now of developing and refining the survey and the techniques behind it, which brings up the question of, well, why not just use one of the many existing and frankly quite good surveys that are out there? Well, the simple fact is none of them met all of the needs we had and the needs of our stakeholders. So we designed from the ground up, but building from the existing work, a new survey that would fill all those needs. To that end, we spent quite a bit of time. We spoke to patients and got a sense of what was the information that they wanted us to convey back to their doctors, what was important to them in the encounter with their physician. We also talked to them, just getting a better sense of the wording of questions to make sure that they were easy to understand and meaningful. There's a lot of people involved in practice improvement in primary care. It's not just about the physician and it's not just about the patient. And so we do include a lot of information in our survey that's useful to other stakeholders, to clinics and clinic managers, to primary care networks and to other stakeholders along the way. One of the big difficulties with this kind of surveying is that it can be extremely cost prohibitive. We have managed over the 2 years we've been doing this to bring our costs down to pennies on the dollar compared to our original paper surveying. We were handing out paper surveys. And now we are providing, we're doing this on email, and our costs are just a fraction of what they used to be. Every physician who participates receives a personal, confidential, anonymous report on their patient's experience. Going forward, our next steps on this are to begin to really spread the word about the existence of this survey, because there are 4,000 primary care physicians, give or take, in the province, and several hundred clinics, and get them on board and to help educate them about the importance of this work and how they can use their patient's experience, those measures, alongside of outcomes and clinical outcomes to help improve the practice that they, help improve the care that they provide. Thank you. Just spin around in circles.
Yeah, thanks for your presentation. I think I asked you this question earlier, so you should be primed for it.
Yeah, I totally remember what it was.
Yeah. So with this feedback, how does it drive accountability in the province?
Yeah, so that's part of our next steps going forward. Is right now we're providing that feedback and we're saying, here's the results from your patients. But that doesn't take the next step of, so what? And that's a really, really important step. And so that's one of the next places we need to go, is to be able to say, you know, you're 20% fewer people are reporting having a good experience in your office compared to all the other physicians in the province. So what? How do you develop that? So that's one of our next steps going forward, for sure.
Any plan to coordinate or orchestrate with other surveys that physicians already receive, and maybe they have their own survey on the counter, patients can fill it up anytime they want? So,
yeah, for sure. I mean, the fact is that there are a lot of surveys going through primary care offices, through all doctors' offices right now. We are working with various different groups, like primary care networks, to see if we can provide their surveying that in some cases they're already doing. And they're coming to us and saying, well, we can do it at least as efficiently and provide broader comparisons for them. So, you know, there's a lot of groups that we would love to be able to work with to provide surveying for them. I'm not sure if that is.
Talking about survey, you said you're doing it by email now. So what is the percentage of return you get or you expect to be getting?
Yeah, so as we've switched over to email, our costs came plummeting down and our response rates actually went way up, and we're getting over 50% response rates from our patients. So we would have been happy at sort of 10 to 20%, and we're well above that. And we even get very good response rates from people who you might not expect. So older Albertans are 65 and over are responding just as much as they did on paper.
So to keep this model sustainable and keep on the surveys, how do you plan to keep it going, pay for it? I know you brought costs down, but how do you still pay for it?
Yeah, so the model right now that we're looking at is going to be a cost-sharing model with clinics. It'll be at the sort of at the clinic level where there will be a contribution from them to have us do the surveying for them and the reporting and everything involved.
Questions? Thank you very much.
Yeah.